Sometimes people feel like their ears are stopped up, or they feel like they're just not hearing as well in group situations with background noise. They can't hear their family members as well. Sometimes they do have ringing in the ears or some kind of sound in their head that they're not sure if it's real or not. Sometimes they feel like one ear is better than the other. Also, as I said, balance issues or issues with dizziness. I do hearing testing of all ages, and part of my job is also fitting hearing aids for people who need them. I do a lot of diagnostic work for hearing loss, dizziness, tinnitus or ringing of the ears, balance issues. We put you in the audio booth. It's a calibrated soundproof booth, and we generally use headphones, and you will repeat some words and you will press a button if you hear some tones, and it's a very easy test. It doesn't take that long, and it's covered by most insurance. Having a baseline audiogram is important because if we see changes in your hearing, that can be symptomatic of other issues that are going on with your health. Even things like poor vascular supply to your brain, or small tumors that generally are benign but sometimes not. So it's a good idea to have your hearing checked and to have it monitored. If there is any change in your hearing, it gives us a lot more information about your overall health. It really is important if you suspect any hearing problems, or if you've just never had a hearing test, to get tested. It is covered by insurance, and it's really very important to get a baseline audiogram, especially as we age. We know that you will age better if you can hear better. Jefferson Surgical Clinic, the surgeons you choose.